company's health. This is the first episode of our podcast. So excited because, we're going through a crisis right now, and I'm glad to have my co-host, Anne-Marie. Hey, Anne-Marie.
Hey, Andre.
And my good friend, Dr. Wes Bailey. Now is a great time to speak with you, even with COVID crisis. There are a lot of good information and misinformation going on out there. So we just want to have a chat with you and see how it goes and see how you can educate us. So Wes, how are you?
Doing very well. Yourself?
So first thing, tell us, give us some background. Tell us about yourself and how you started your career.
Well, I practice family medicine and non-operative sports medicine in Georgia. So I help folks prevent problems such as high blood pressure, diabetes, sports injuries, and muscle and joint pains. And I also help folks treat such problems if they've already developed. I see kids, young kids to elderly adults. In terms of how I started, I always knew I wanted to apply science to helping others, so I always had an interest in medicine. I took the traditional route, completed medical school, followed by residency in family medicine. I also decided to seek extra training in non-operative sports medicine, so I subsequently completed a one-year fellowship program. And then afterward, I entered official practice.
So I mentioned initially about the COVID, it's all over the place. We're in this together. So from your perspective, what are some of the key things that we should be doing personally? And also, as Anne-Marie and I were, business owners, to maintain a safe working environment.
Well, this issue has come up on actually a daily basis during the course of my natural patient interactions. I guess from a personal standpoint, the big idea is finding ways to establish and maintain a healthy function. So one big point of emphasis during my discussions with folks is basically controlling what you can control. One thing I've been encouraging folks to do is to try as best they can to establish and maintain a home routine. Obviously, with the pandemic, it's caused significant shifts in terms of our daily functions. So I've been encouraging folks to do things such as scheduling walks, exercise, reading, meditation, phone calls, etc., just to try to maintain some sense of true normalcy at home during a time when things clearly aren't quite normal. Also, I've been trying to encourage folks to think of ways to improvise. For example, if you're accustomed to exercising at your employer work site, but obviously can no longer do so, I try to help folks think of ways to develop kind of safe exercise routines at home. That way, their lives don't just stop, so to speak. Another point of emphasis has been maintaining awareness, trying to access reliable sources of information so that folks can remain informed. So, for example, I've been encouraging folks to at least check out sites such as the state public health site to just get reliable data and public health advisories and recommendations. That being said, it's important to be selective with respect to information services and to consider limiting daily social media exposure. With the variety of media platforms available, offering articles, memes, and videos, there's considerable variation in terms of the validity or reliability of the information on these platforms. So this altogether can contribute to feelings of worry, confusion, and just simply miseducation. So as part of my overall counseling, I've been encouraging many folks to limit their social media access to benefit them.
Can I ask you a follow-up question? We've talked about this before, in our practices. We've talked about the challenges of changing client behavior. Is this situation different for you? Are people more compliant, or are they receptive, or do they pretend that they're compliant? I mean, what do you find is happening?
In general, folks are pretty open-minded, and they want to kind of make certain changes. For example, I have many patients who are trying to deal with problems with blood sugar control, blood pressure, and high cholesterol, and many of them are saying, hey, I finally started making these nutritional adjustments or getting into exercise, and now I'm stuck at home. What do I do? So many are kind of distressed by the fact that they don't have the answers readily available in their heads. So I've been finding that counseling on these lines has been quite successful during our visits, whether it's in person or telemed visit. I've been actually able to make some extra strides with some patients, actually. So.
That's good to hear.
So, and Wes, you kind of touched into one of my questions. I know telehealth is a big thing now, right? How do you see, this? How do you see this moving forward, or is this going to be that big thing where we're going to all, move into telehealth or utilizing that?
Well, it's been available for years, and various practices have been kind of integrating those resources into their kind of daily functions. So I just think you're probably going to see more of the same. You're going to see more and more practices offering telemedicine kind of consultations and evaluations. So I really just think you're going to see more of the same, to be honest with you.
And from your perspective, is it very effective and efficient, what we used to?
I think telehealth or telemedicine can be very effective if used appropriately.
Okay.
For example, during the current pandemic, it has been very helpful for us and our patients. Mainly, it has helped us to ensure healthcare delivery while ensuring that we remain in lines with current public health recommendations for the greater good. There are also some other practical benefits as well, as I touched on earlier. For example, for some folks, I've been able to see some of the household items in the background when talking to them. And because of this, I've been able to help them devise home exercise regimens to keep them going as they're relatively homebound these days.
I've been glued to the TV, looking at stats here or there. Mm-hmm. But in terms of, I noticed that minorities, there seems to be a high occurrence of cases with the minority population. Why is that the case?
Ridiculously high proportion, yeah.
Yeah, it's a multifaceted issue, obviously. There's no one answer to completely explain everything, but I do think there is one major point to consider in terms of these outcomes you're referencing. I'll start with one of the more obvious items. We know that certain conditions such as high blood pressure and diabetes are associated with more complications, hospitalizations, and death. These conditions happen to be more prevalent in the African American and other minority populations. Complications from such conditions such as end-stage kidney disease requiring hemodialysis are more prevalent in these populations as well. This naturally takes us into that realm of disparities, which means truly a difference. There's a difference in the burden of major illnesses and respective complications in the African American and other minority communities. There are also differences in terms of healthcare access, healthcare usage, healthcare quality, healthcare or insurance coverage. This has been very well established for, I would say, easily the last 20 or 20 plus years. Overall, this is just tied to overall health risk in general. So if you take this in mind, and then you add in an element such as coronavirus, which would add an extra stress to the human body and system. Unfortunately, African Americans and other minority populations are going to be more likely to have worse outcomes overall.
Do you think that there's also a factor where there's a lot of undiagnosed high blood pressure, type 2, that kind of thing in the community because there isn't that regular health care, or they don't have insurance or whatever the situation?
Absolutely. It's part of the
hit with the virus on top of that. Yeah.
Absolutely. It's part of the snowball effect, if you will, when we start talking about the effects of healthcare disparities or health disparities. So I do think that's coming into play as well.
So my follow-up question to that then is, what specifically do you think people of color can do to protect themselves, or should be doing to protect themselves? Because it's clearly a problem nationwide.
I think the big thing is, as best as one can, trying to really establish a healthcare team, at least starting with a primary care doctor. As I mentioned earlier, there are significant challenges in terms of access to healthcare affecting various communities, but I do think we all collectively have to work together to see if we can make a dent with respect to this problem. So I think that's the big place to start, just getting routine screenings for things such as diabetes, high blood pressure, and high cholesterol would be the key place to start. Along with that will come your avenues for education as well. One thing that affects folks is, like you're saying, sometimes folks may have mild symptoms or subtle symptoms, so they may not know that this could be signs of something more ominous. So by the time they may actually present or seek help, they may be far into a very dangerous process. And I think that is coming into play with some of the outcomes you're seeing with COVID-19 as well.
Yeah, I doubt most people could name, what are there, 6 symptoms now? I mean, most people are thinking fever and cough. That's all they got in the last 3 months. They don't understand that there's a list of symptoms now. I think that might be part. Overall, the education is a problem.
The part of that too is just that basic step of just reaching out to contact a healthcare professional, whether it's your physician or supporting staff such as a nurse at the doctor's practice. Just having that access available is a challenge for many folks.
How do you see this rolling out? Like, I know that in South Georgia, for example, there are no hospitals anymore. You know, people that are getting sick in South Georgia who are people of color, they're getting the virus. They have to get in an ambulance and be driven for an hour to get to a hospital. And I'm sure that's in lots of places, not just South Georgia. To me, in my mind, that's a huge problem. And we need a solution now. I mean, people need help now. So do you have any idea of how that could be addressed? I mean, is it a mobile situation where we set up, like, can we use the National Guard to set up mobile facilities? I mean, why not? We've done it in other places.
I think that's a good idea. You
know? We've actually been hearing such ideas for at least the past month or two, actually. So those thoughts or concepts you just raised have been going around, and we've seen kind of similar efforts in Georgia as well. For example, certain hospital systems may be designating certain sites, for folks who clearly need COVID testing.
But then you still have to drive for an hour to get there. I mean, that's a problem.
Not always, but I know in certain parts, typically your more rural areas, that's definitely going to be more prevalent. So I think this is ultimately a situation in which we're realizing a need in the midst of a current pandemic. So I think, or hope moving forward, that all of us, the different healthcare institutions and policy institutions, collectively will work together to kind of ensure a robust response to such developments in the future.
Yeah, it's certainly shining a light on it. Have you seen, I believe it was the University of Michigan, there's a neurologist there who's suggested with another neurologist that we use all of the academic laboratories that are set up in the United States to do testing. I mean, they've got all the equipment, they've got all the personnel, everybody's trained. Instead of having LabCorp or somebody have to go out and hire people and set up labs and, buy equipment, these are all just sitting there fallow right now.
Again, that's a concept that isn't exactly new these days in the setting of this pandemic. It falls under that topic of just increasing testing resources and access to testing, along with potential, for lack of a better phrase, barriers to testing as well. For example, there's been more of a widespread push to have testing available without necessarily having a doctor's order, especially in certain places where access to healthcare has clearly been a challenge for folks.
That just happened in Georgia now. You don't need symptoms to get a test as of today, which I'm excited.
I'm hearing about this in other states as well, so I do think it's a trend that will continue to play out.
And I think that is important, even for people who are asymptomatic, to know if you're immune to the disease. So I think having those testing sites that's very important.
Yeah, that's key, isn't it? I mean, it's the asymptomatics that are the problem, not the sick people. I mean, to contain the virus, if we want to control this situation, it's the asymptomatics that are the issue.
I think that the testing goes very well along with just general precautions. For example, we've generally been encouraging folks to wear masks as much as possible, particularly in public, regardless of whether you're having symptoms. That's with respect to the fact that many individuals are asymptomatic, meaning they're not going to know that they can infect others. They're not going to know that that their bodies are currently trying to fight off infection.
You brought up masks, right? I know I try to run a couple of miles, a day or so, 3 times for the week. Should I be wearing masks when I'm running, Wes?
So that's a good question, and it does come up too. In general, wearing a mask during running when you're not accustomed to doing so can be risky. So I would generally truly recommend just checking with your doctor first before doing so. the question would be too, in terms of the intensity of your run, the distance, what will be the environmental conditions. Do you have other issues such as seasonal allergies, asthma, etc.? So the answer really will vary for individuals.
Good to know. My thought, because I was listening to some experts, and they're saying that the good thing with the mask, when you have it on, it protects you from, people who try to touch their face all the time. Once you have on the mask, it protects you from, not touching your nose or your mouth. So that's the advantage of actually wearing the mask. And even gloves. Anne-Marie and I were talking about gloves earlier. So when you actually wear the gloves, it reminds you not to touch your face. Or what about gloves? You think we should wear that in public?
Yeah, there's a lot of debate on that. If you're going to wear gloves, and if one is aware of principles of infection prevention and avoidance of contamination and cross-contamination, then wearing gloves might actually be beneficial. But if you're going to wear gloves and then you're going to grab your phone and touch everything else and then touch your face, then it kind of defeats the point of wearing the gloves in the first place. So that's why you're hearing a lot of the debate in terms of whether wearing gloves will truly be effective. I would say if you're going to wear the gloves and be very mindful and aware of the principles of cross-contamination, infection prevention, they can be helpful. Otherwise, they might not be as helpful. And again, with that too, is going to your public health websites can be helpful. Also too, calling your doctor. That's a perfectly valid question with which to call your doctor and ask. So,
cool. Thanks for that information. So another thing, I'm just confused here, right? When it comes to groceries, because so we use my wife and I, we use Instacart, right? And they would bring the groceries to the door.
Mm-hmm.
So should we take the bag in, or because my thing is I would put on the gloves and I'll wipe them off from there before I bring them in. How do we treat groceries, or is it something that we should? It's not a problem, or
as best as one can, I would try to have an isolated area for outside objects. One common example would be the garage, where you would have an area for wiping things down or sanitizing them, if you will, before potentially bringing them into the house. So that would be the ideal situation.
Right, because I'm thinking we could go crazy on these things. When we get the chicken, should we, wipe off the outer wrapping and then, wash it? And bread, what do we do with bread? Do we strip off the bag? And so it could be, a lot of.
It's a slippery slope.
Yeah, but so the idea then, Wes, is that as you mentioned, just have a separated place like in the garage, just to put them, clean them there, and then bring it into the home.
Yeah, it's taking every reasonable precaution one can. There's not going to be any one measure that's going to be 100% effective in terms of guaranteeing that you won't contract this virus, but you're really just trying to develop and practice good habits to at least lessen your chances, to minimize them as much as you can.
And Wes, I know you're a sports medicine doctor. So what are the sports that we can play now? Should we be playing sports? Right?
Well, the same principles apply to athletes, whether it's football, basketball, rugby, baseball, soccer, ballet. It's the same principles will apply to those populations as well. That's why you're seeing a lot of the sports leagues put things on pause. That's why dates for resuming such activities are still to be determined at this point. You're even seeing it at the college level, because the same principles apply.
So what about golf? I mean, it's just me on the ball, and I mean, I could keep like 6 feet.
Right, but we don't want four people standing right around the hole at the same time, looking at each other without masks. That's the type of situation we want to avoid. So those same principles apply there.
So you're saying for golf you can play, but you have to take precaution.
Yeah, and in general, you want to try to maintain your normal activities as much as possible while adhering to these precautions. For example, social distancing. If it's an activity where these things just aren't possible or aren't practical or just going to be too hard to maintain at any sort of consistent level, then I've been generally advising folks to avoid such activities, at least for the short term, until we can get more public health data and information to help us provide further guidance.
I'm wondering if you've seen any positive effects on your patients, your clients, because I do see a lot of people out walking that I didn't used to see, even though we suggested it all the
I've
time.
noticed the same thing. Yes, the short answer. I have seen it. I've noticed the same thing. Leaving my home in the morning and going home at night, and even on weekends, I'm just noticing exactly the same thing. A lot more folks are walking than I've ever seen.
Yeah.
So there seem to be some positives coming from this, and I've also noticed this with some of my patients. Paradoxically, some of them are exercising now more than ever. I've been working with them to get them to exercise more for several months, and now they're exercising almost daily. So
Yeah.
I've seen some positives. Yeah.
It's funny, since we set up the Zoom, we set up Zoom classes in the studio, and same thing. People are working out 5 days a week now, 5 or 6, some of them, which is good.
Yeah.
Have you seen any numbers change, like somebody's blood pressure coming down or anything like that you can quantify for them? The data might encourage them to keep doing this, right?
Yeah, not quite. I have seen some weight loss, so that counts. So I have seen that, but I just think I probably won't see any clear trends, if you will, for at least another month or so to give them time for these changes to truly take effect physiologically. I do anticipate a number of patients will have lower blood pressures and better numbers the next time we see them in person and are able to update labs, blood pressure, etc.
Yeah, that's going to be interesting.
But I do have some folks who are losing weight, even though they're relatively homebound. So that's been awesome.
Mm-hmm. Yeah, great.
Wes, I wanted to ask you this. You know, we're discussing this a little bit earlier. We're seeing some numbers out there in terms of cases here in Georgia, right, from a county level. But I don't mean to put you in a spot. But where can we get the zip codes level to know, what are the cases in specific areas? Is that available out there?
From what I'm seeing, the Department of Public Health website has provided the most detailed information region-wise, not just by giving you numbers, but by giving you kind of photographic illustrations as well. For example, graphs. I'm thinking if you desire more information, perhaps giving the Department of Public Health a call, that'd probably be the best approach to it. But I have not seen such specific data quite yet. Perhaps there are authorities who are working on this and gathering that data, but to my knowledge, that data isn't readily available yet.
I would have believed that, if we have that information out there, I mean, we could combat this disease even better, because I would know that, hey, I need to stay away from that zip code, because there are a lot of cases there. You
need to get better at social distancing and wearing your mask in certain zip codes. I mean, that would be good information to have.
Yeah, I think the more that we all collectively kind of follow those guidelines, the better chance we'll have in getting this pandemic to quell. But I do think, for what it's worth, I know the Georgia Department of Public Health website does have numbers by county at least. So I do think that information can kind of get you going in that desired direction, knowledge-wise.
They definitely have county. I have seen zip code, but I have to go back and dig out where I found that, because I have seen it by zip code, which was interesting.
If you're located, send it my way. So
Definitely.
I'm curious as well. So
no, it helps. I mean,
of course.
To see where things are, because we were talking earlier about nursing homes, like in Roswell. Apparently, this is a self-reporting situation right now. But in Roswell, only 3 nursing homes have reported test results. I know there's more than 3 here.
Yeah.
And that feeds into the county data. And in fact, one of the nursing homes was incorrectly listed as Cobb County rather than Fulton County.
Oh,
so that makes me question all the numbers, but
they're get that corrected. So
yeah, it's just scary. I just believe, I mean, more information, would help all of us,
Yeah, data would be nice. So one of the things I know I've been seeing a lot of on social media is all kinds of stuff about home remedies. Where do you fall on that, Dr. Bailey?
I'm not against home remedies. However, I've been very clear with folks, if they're developing any combination of symptoms that we discussed, the very first thing is to self-quarantine and call us, and that we'll take it from there, and not to try to just treat it themselves.
Right. Okay.
Well, so Wes, I know we've been speaking a lot about COVID. From where you're sitting, where do you see this going in terms of timeline for vaccine, or when we can be back to normal? Or will we ever be normal again? Or where do you see this going? Next 3 years down the line, or?
Well, from what I'm reading, researchers are actively working on developing a vaccine, so that may happen within the next a few months to several months, from what I'm seeing and hearing. So, I'm pretty optimistic along those lines. In terms of normal, in all likelihood, there's going to be a new normal, if you will, not just for folks individually, but for organizations and businesses as well.
Yeah, I think a lot of businesses are going to realize they don't need the fancy office, and others are going to find out that they desperately need it. So there's going to be a shift.
Yeah, there's going to be a lot of changes after this. And another thing that I wanted to ask you was from a healthcare industry perspective. Where do you? Because I'm big on trends. I'm a digital marketer. I'm big on trends. Where do you see healthcare in the next decade? Is there any new trend, or where do you see it going?
I think you're going to, like many others, I think you're going to see more integration of telehealth or telemedicine resources into clinical practices, whether it's on hospital floors, hospital units, or our outpatient clinics. I just think you're going to see more usage of those resources, more availability over the next several years.
So has this affected how you practice your medicine already? Because it seems like, to some degree, when you have enough experience, I suppose you can look at somebody. I mean, I can do that in a studio. I can look at somebody and assess their biomechanics or whatever I'm looking for. But at some point, have you already figured out what the line is where you have to see somebody in person?
Well, that goes back to my earlier point about using the telehealth resources appropriately. So during that evaluation, you are making as many observations as one can. You're asking very specific questions as you would if the person were standing right there in your office, and then you're using your clinical judgment to figure out whether it's a situation that you can manage while keeping the individual at home, or whether you actually need to bring the individual out to your office or direct them to a higher acuity facility for treatment. So the ability to make those calls naturally come with experience, regardless of profession. But also, too, it's one of those things where you're constantly honing that skill as well. So I think it's both.
Yeah, because there's a lot to like about telemedicine. I think, it keeps you safe. It keeps everybody in the waiting room safe. You're not bringing somebody in with a communicable disease. It avoids unnecessary stress on the patient, the client.
That's a good point. Yeah.
So there's a lot to like there, especially when you live in a place where you have to drive somewhere and there's traffic and, accidents and all that crap.
I think having it available too helps to lessen barriers to healthcare. Oftentimes, just the simple process of getting ready and driving to your doc's office will deter folks from even showing up, and so that can be tied into suboptimal outcomes in terms of your blood pressure control, for example.
Yeah, and that goes back to that whole idea of people who are in more rural areas and they don't have healthcare facilities nearby. I mean, this is a viable option for them, I would think. To some degree, it could help with at least triaging, if nothing else.
Yeah, and it helps address the access issue amongst other issues. So
yeah, it's kind of exciting, actually.
It is. I think telehealth is going to be great as we discuss about access and people in rural area. So Wes, I know we have been talking for a little while. Anne-Marie, do you have any more questions for Wes, or you don't want to keep him here? I know he's just kind of want to go home and eat.
No, I think this has been great. I guess maybe one last question, like how do you imagine us rolling things back out, like essential services? What's the next level after we know what the essential services are now, right? We've got truck drivers and people working in distribution and healthcare workers like yourself. What's the next level? What would be the next level of essential services, like, and the level after that. Because for me, nail salons and hair, beauty parlors, that's way up here somewhere. It's not the second wave to roll out. Like how do you see that rolling out in a way that's safe for people when we don't really have the numbers on who's infected yet?
That's kind of just it. I really don't have a good firm answer to that question. I think at the end of the day, we need more objective information, such as data, to help guide us. And then I think really we'll just have to follow suit in terms of our local government and local healthcare institutions who are working together currently to help kind of guide the masses. I just think you're going to have to see a continuation of that kind of mass cooperation here to help us kind of figure this out.
I was wondering, because I think Governor Cuomo in New York has kind of layered it a little bit and said, things like teachers and social workers and, that next level of service providers would be the next level that they open.
Mm-hmm.
But yeah, it is a tough one.
I imagine the rollouts will vary by state and regions as well, just to reflect kind of differences with respect to economy, demographics, et cetera. So I anticipate you're definitely going to see some variations across all the states.
All right, Wes, it comes to the point now where we ask some fun questions, right? Some fun questions. So what is your favorite sport?
Tough one. I'll go with college basketball.
For basketball, what is your favorite dish?
French toast.
French toast?
French toast, really?
Yeah.
I love French toast.
Pizza's a very
My daughter loves French toast too.
And so if you could say one thing that we don't know about you, they're a unique thing, what would that be? Apart from the French toast, like something unique.
I don't know if it's necessarily unique, but I like to bake. I like to bake brownies.
Oh, that's good to know.
Exciting, I know.
Yeah, definitely. All right, Wes, thank you so much, sir, for joining us on our first episode of this Company Health podcast. Looking to have you again in the future. So before you run, tell us how anyone listening can reach you, and you can give us your website or any other pages that we can reach you.
Yes, I'm with Perimeter North Medical Associates, so you can access us online at www.pnfm.com. Also, I do have a page on LinkedIn as well. It's my name, Dr. Wes Bailey, so folks can feel free to connect with me on that platform as well.
Thank you so much again, sir. It was a pleasure. Great conversation.
Yeah, thanks, Doc, and thank you for your work. We appreciate it.
No problem. We're all working together, so I appreciate y'all having me.
All right, thanks. Have a nice day, sir.